when COVID crash landed on us, the healthcare system creaked. And we continue to work towards overcoming COVID-19. We continue to mitigate and recover from the first. We are still, and I believe we are still in the first wave. And some countries are now on their second and third waves of the worst pandemic our world has ever experienced. And truly, because of this, there have been some disruptions. The impact of the global pandemic to the healthcare system, particularly to nursing, was tremendous. Stressed, pressured, anxious, fearful, because of the forthcoming changes that happen in the healthcare system. Even as administrators, as early as January, when we first knew about this disruption, when we first knew that COVID-19 is just around the corner, we became so frightened, we were too anxious because how would we manage the disruptions in the healthcare system? The first instance, we tried to look into the resources that we have. Do we have enough to be able to provide our nurses? I guess this is not only true for our hospital, and this is true all over the world, even from the biggest to the smallest hospital. Innovative task shifting is very important because we have to look into our human resources. Will we be able to manage the changes that will happen? Will our nurses be able to really provide the care? We have to really put up a matrix to find out, our nurses, are they able to be assigned? Will they be able to be assigned in a COVID area? Are they prepared to do that? We even look into the comorbidities of our nurses because we cannot sacrifice our nurses with comorbidities to be assigned in the COVID area, realizing that they may be exposed unnecessarily. And of course, vital equipment sharing, even donations from different organizations, because equipment is necessary to be able to fight this COVID pandemic. We have to understand that at the earliest possible time, we have to know whether our patients are having the symptoms, how do we manage them? Quick, assessment and quick diagnosis is very important. The second impact is, in terms of disruption, would be restructuring of services. Our director said, we will have to let go of some of our patients, quickly discharge our patients who are well enough, and we will split the hospital into two areas, a COVID area and a non-COVID area. What are the components that will parallel with all of this? We have to reorganize not only the beds, we have to put distance between the beds, and we have to put in a lot of our resources together. We have to gather all the resources, the ventilators, and find out how much do we have. And splitting this is not easy. The impact really is so great that as administrators, we become so worrisome. We became so pressured because we have to do it quickly. The fluidity of decision is there. It has always confronted us, and this has made us really very frightful. The next is the adoption of mechanism to identify transfer patients and personnel to reduce cross-contamination. Again, the surge planning should be there. We should have developed, and we have developed the system of having a checklist. Who will have to be transferred in terms of whether they are suspects, they are probable, or they have been positive already for COVID-19. Who are the patients who need to be separated, and who are the patients that need to be welcomed? Welcome is not the word really, but who will have to be taken in coming from the other hospitals. And definitely cross-contamination is very necessary. We have to be aware of this. We have to be careful in terms of reducing cross-contamination. That's why our infection control unit has worked overnight, sometimes sleepless, in order to orient us nurses, in order to provide the information to our nurses on what to do in order to reduce cross-contamination. There had been rapid changes of situation that affects communication and transfer of information. Maybe a lot of our nurses all over, not only in our hospital and even in other hospitals, would find that communication is not enough. Communication is confusing. Communication from up, down would be not that quick, that they have to do something in order to bridge the gap. But definitely the situation is very fluid. We cannot do so much. But what is important is through mechanisms, through infographics, through calls, through meetings with nurses, we have to provide them the adequate information and transfer of information so that all will be aware of what to do. There have been revisions of models of care. Again, shift from non-critical to critical care nursing. Non-critical nurses assigned in non-critical areas had to learn quickly how to take care of critically ill patients. And we have to do it quickly in terms of orientation and training. We had to do Zoom meetings. We had to do a lot of video presentations in order to provide our nurses with quick knowledge, quick training, the basic things to know in order to be able to take care of critically ill patients. We have to find out, we have to make proper assessment, we have to screen patients, and we have to identify the appropriate intervention needed by our clients. Again, I mentioned changes in schedule and work assignment. We have to divide the hospital into 3 teams. 50% of our human resource should be out of the hospital in order not to contaminate a lot of people, and this has created a lot of impact, a lot of anxiety, a lot of fear. And some of our nurses had to think quickly whether they would decide to stay on or not. Some of our nurses left the institution fearing for their lives. But definitely it was so difficult because we had to be in the battleground. We have to understand how it is in the battlefield. And it was like being in a war room, trying to find out how to become very effective in terms of providing the schedule of our nurses. And definitely, and this is where I am very passionate about, there is a high demand for psychological care and support, not only for our patients, but most especially for the caregivers. You know, they said that a lot of our nurses became contaminated, have become positive for COVID-19, mainly because they have been exposed, because they have been anxious a lot of time, they have been fearful. And there are moments that they forget things. Unless we provide them with the high psychological care, all of this will happen, and there will be more people coming in for COVID positive and be admitted in the hospital. As nurses comprise the largest component of the healthcare workforce, we play a very significant role, and all of us should understand this, in terms of developing practice and preserve the core values of the healthcare systems globally. It's not only in the Philippines, but globally. This is the International Year of Nurses. I can say it's becoming ironic, but it is also a big challenge for us because we can lead the healthcare workers in trying to find out what are the best practices that we can do. We can share best practices with the rest of the world because we have innovative practices that actually help support our patients. And we are very proud in our hospital because we had established or registered a 70 to 75% recovery rate for our patients because of the innovativeness of our nurses. So as nurses, what are the critical roles that we need to play? Because this is not ending yet, we have still something that we look forward to beyond. Because a pandemic may not end with COVID-19. There can be more. So as we play a critical role in preparing our services, we have to understand that coordinating interdisciplinary care is very, very critical. Communication. This is where teamwork and collaboration should be manifested clearly. This is where teamwork and collaboration should be done across services in the hospital. Nurses being at the front line can really be the one who should be able to orchestrate the coordination of care because we stay with the patients longer than the rest of the healthcare workers. Second, how do we mitigate complications? As I mentioned, there have been innovative practices that we have done. Let us write them down so that next time we'll know what to do. We have done a lot. We have done our way of really telling our patients, yes, you're not alone. Nurses coming in, telling our patients that we are here for you, providing them connection between them, within the patients and the families through media, through social media, providing self-care. As a patient safety advocate, it is very important that we should not forget provision of safe care. There are new medicines coming and the new technology coming, the new diagnostic practices. We all have to know this because we have to provide safe care. And definitely, managing psychosocial needs of clients is very, very critical. So what are the leadership expectations? As a leader, I know that our nurses expect us to do a lot of things. One is to be visible and lead team members, mentor amidst uncertainties due to the pandemic. The second is creating opportunities to develop and leverage new processes. As we are now towards our third month in this pandemic, in this lockdown, there are a lot of processes that have been identified. In fact, I have to tell you that the Board of Nursing is now fast-tracking the presentation or the submission of the comprehensive nursing bill, mainly because we need to protect our nurses and we need to tell people and our politicians, our government officials, that we have processes to be able to help really move forward in terms of providing the care, not only for this pandemic, but in the future. And of course, we have to maximize productivity. A lot of our clients, a lot of our nurses had to be off. We have to maximize given the dwindling number of human resource. And how do we do that? Again, by guiding them, by providing them opportunity to tell us that yes, we are doing this, we are trying to innovate this because this is the thing that we can do to help our clients. And third, providing mechanisms towards psychological well-being of the staff against the backdrop of fear and anxieties. Thank God that 2.5 years ago, we were able to establish our counseling group. That's why at the start, when the director informed us that we will become a COVID referral hospital, we gathered our nurse counselors. We rehashed their knowledge of how to do counseling. And we have incorporated our debriefing or counseling with the orientation of our nurses during the start of this pandemic. We are not saying that it has become foolproof. We are not saying that we have minimized significantly the anxieties. But what is important is we have provided the platform by which our nurses are able to discuss and share their fears, their apprehensions. And we are able to actually listen to them, provide catharsis, and provide them with opportunity to understand why they are experiencing fear. A lot of them were saying, am I different because I'm very fearful? No, because fear is normal for all during this time. So what are the critical responsibilities that we need to really come up with, not only today, but in the future? Managing the gap in knowledge and skills. Again, not all of us are infection control nurses. We have to gain this knowledge, skills on screening, disease identification, the care of our clients, infected or exposed clients, and the prevention of complications, and definitely psychosocial support. What is important, because the patients stay with us for long, we have to prevent complications, not only in terms of physical, but the psychological implications. Because I remember talking to one of our healthcare workers. He was telling me that I'm so fearful, ma'am. All I had to do was walk around my room. I do not know if I will be going out alive after this experience. I know that I have gained weight because I've been eating a lot, but I'm too frightened until now. And he was telling us and telling people, do I need to go through this for the next couple of days more? So a lot of mental problems emanated from this, not only amongst the healthcare workers, but among the patients. And I have one counselor who is a senior citizen, not a healthcare worker, who I had to do some counseling because he was fearful when it was announced that no 60 years old and above should go out of their house. Imagine that. Imagine that happening all over the country and all over the world. Second is helping navigate the changes in these challenging times. Again, leadership visibility is very important. You need not go and don the level 4 PPEs and go inside the COVID area units, but instead be there in terms of providing information. Be there probably to talk over the phone, tell people I'm here, I'm available, and I'm ready to listen. A lot of nurse administrators can be actually having comorbidities, and a lot of us are already senior. But what is critical is being there in the hospital, navigating, being present all the time, listening, providing just a wave to our nurses was something very, very critical in telling them that I'm available and I'm giving you support. Timeliness of communication is very critical, definitely. You cannot, a lot of changes, the fluidity of the situation. In it is very imperative that we have to communicate everything. Communication should only be consistent. It should come from above, and it should be all uniform. Otherwise, people will get confused. Again, proper resource management. Thank God that the hospital was able to receive a lot of donations. And because of these donations, we were able to cope with the difficulty of really donning and doffing and giving opportunities for nurses to get out from the unit at least for a few minutes to eat, to breathe fresh air, and to talk with our safety officer. Because our safety officer, our head nurses who stay at the donning and doffing area, giving again visibility and opportunities for our nurses to whom they can verbalize their anxieties. Peer and team support, need I say more? This is very critical. Again, this is collaboration. We have to have friends and co-workers giving support. It may just be a hi to you. It may just be giving you certain things that you need. But what is important, that peer support is very important. One thing that I have to mention, there was an article written, and there was a news should we say, a news article about people getting, or healthcare workers getting positive because of congregating in their eating area. I think Filipinos love, to interact. We miss the fact that we have to talk with people. We miss the fact that we have to share. Yes, this is very important because this is part of mental health. But again, it is important that we have to understand social distancing. We do not say that you should not talk with people. There's social media. But what is important is let us provide an opportunity where we can relate our experiences with our peers so that we get emotional support from them, considering the precautions and the prescription of infection control. And finally, again, I'm mentioning this for the third or fourth time, ensuring psychological well-being of nurses. So an important leadership strategy, and I cannot, let go of this important item, providing the robust communication plan. Let us allow our nurses to participate across designation for inputs and feedback. This is the best way that we'll be able to manage, to be able to understand what they're going through, to be able to understand why they are very anxious, and why are some nurses deciding to leave the service. Because we have to get the feedback so that we can create a better plan in the next couple of days, making things effective in terms of providing care and making sure that we're taking care of our workers. Second is engagement of nurse leaders across unit to design the framework. And what is this framework? The framework of providing communication, the framework of teaching, orienting, training, at the same time providing psychological support to our nurses. We have to engage everyone, even the utility workers. We should listen to them from their feedback, not only nursing leaders, because from the battlefield, they know how it was and how it is to be able to be exposed in that situation. There's a need to develop training and education fast. I attended a webinar composed of ASEAN chief nurses from Singapore, Malaysia, Thailand, and China. All of them are saying we have to be quick in terms of development of training tools. This is not ordinary training tools. We have to make it more acceptable and appropriate to what is happening now. And this can be done because of the framework that we have established. And of course, again, the mechanism to provide psychological support. How do we embed engagement of everyone? As a nurse administrator, I have the belief that everyone, anyone, from up down to the lowest level can participate and provide us with important information to be able to address fully, to be able to take care of our carers. Structured team to maximize its potential. Again, the mix matching, skill mix matching of people, so that people who are critical care nurses will be able to teach the non-critical nurses, and that the non-critical nurses will learn from that, and to be able to, provide mechanism to share the responsibility in taking care of the clients. There are conflicts happening every day, and this has created a lot of insecurities and again stress to our healthcare workers, especially to the nurses. As a leader, be persuasive. You cannot say, if you don't like to work, then that's it, resign. You are not indispensable. We cannot say those two words because everybody is important. Let us persuade them. Yes, I know that you're frightened. I know that you're afraid. I know you're anxious. But let's talk about it and let's find a way on how you can be productive and continue to work. Everybody's also frightened on how and not sure on how to be productive. So we can persuade them through our communication skills. Remain positive and supportive. You cannot say we're not gaining grounds because you are not cooperative. We have to be positive. Let us celebrate milestones. Let us celebrate the fact that all of us are together trying to fight this pandemic. Empower innovation and creativity, and let us advocate organizational and personal resilience. And I have to mention this. How do we provide organizational resilience? Again, communication, good decision making, by providing all the opportunities for them to understand what is happening, information sharing, again, teamwork and collaboration, understanding the support for organizational vision and goals, because the goal is to quickly manage, become productive, and altogether be able to send all our patients home. Appropriate and rational staff assignment and meaningful recognition. We're not saying that let us give them certificates every day, but what is important is to say, hi, thank you for doing all of this for our patients. Thank you for being there, and thank you that you continue to work with us, and we are just here behind you. Personal resilience, self-care is very important. Psychologically, what do you need to do? Eat, sleep well, be positive, rest. That's why our hospitals provided accommodation in hotels, in transient houses, so that our nurses can become comfortable and be able to really sleep and rest well. Practice healthy coping skills. What are the healthy coping skills or strategies? Sharing your feelings, verbalizing your feelings, being positive. Use of positive language. At the start of this pandemic, we have heard our nurses saying, alay kami ng ospital. Alay kami kasi hindi namin alam kung ano mangyayari sa amin. Yes, all of us are allies. Ally, sacrifice. But at the end of the day, yes, we may have been given as sacrifices, but according to the code of ethics, we are there to provide care to our patients. What is positive about that is we are nurses and we are doing our work because of our love for our patients and love for our profession. Development of strong social support. We have gained new friends because we have our volunteers from other institutions, volunteers of nurses who have been out of nursing for long and they're back. We have gained social support in terms of organizations coming into us. Let us thank them because all of these organizations are saying we're just here to provide you with what you need so that you'll be stronger, you can take care of our patients. And always encourage hopefulness and learning. Encourage within us that there's hope at the end of the day. There will be light at the end of the tunnel, and there will be resolutions to all of this. When it will happen, we don't know. But definitely, everything will return not normal. We have realized that we have to adapt to certain things to be able to ensure that we will not be stricken with COVID-19 and we will not, infect other people. But there's hope in learning from all of this. Definitely, flexibility and adaptability is very critical. As frontliners, we experience intense emotional, social, and ethical difficulties because this is an extraordinary time. But our goal as nurse administrators and nursing leaders is to avoid the next generation of burnout and highly stressed nurses. Because at this point, we have to support not only physiological, psychological, but also their safety. This has to be prioritized by the nurse administrator. And I have mentioned different strategies on how to do this. Providing counseling is just one of those. There are a lot of ways on how to do it. Your presence as a leader, your visibility, a thank you and a smile to our nurses may not be enough, but it is a start of ensuring that we will not be, we will not have the next generation of burnout nurses. So how do we prioritize the well-being of our staff? Again, I mentioned earlier, briefing and debriefing before the start, in the middle, and as they end their tour of duty. Let us provide them with avenues where counselors can be available to debrief and brief them. Mandating and monitoring of breaks. Make sure that all the nurses will have their breaks. There was even a mention in many literature that maybe we can only provide 4 hours for each nurses and allow them to leave so that the next batch of nurses will come in after 4 hours. That is not, may not be feasible at the moment because we have reduced number of nurses because of their exposure. But what is important is to provide them opportunities to have breaks. We have our doctor who is well versed in the technology, has designed a way for us to be able to document using the computer and for us not no longer writing everything. That is also mandating breaks because every time we sit in the computer, we have breaks. That is also telling us that we will not be sitting there all day or more than an hour writing, but instead we're using technology. Providing opportunities for communication. Again, the visibility of the senior nurse as a safety officer was actually designed so that as the nurse will come out, there will be somebody who will welcome them, guide them as they don, as they enter, and doff as they leave, so that everything will be safe for everyone. At the same time, listen to their experiences every day. Encourage open acknowledgement of the emotional impact of nursing. Let us not prevent them from verbalizing that, Mom, it's exhausting. Mom, I think this is the end of it. I don't think I will still be able to manage. Mom, I'm so fearful. Mom, how well will this end? Just listen to them. Allow people to express. And let us have psychological support. Counselors, psychiatrists, psychologists available in the hospital. A team who is actually assigned just to listen. Allow our nurses to share their stories. Provide a body system, as I mentioned earlier. A seasoned nurse in critical care against a new one coming in from another unit. Teach them. Have a body and don't tell them, oh, pagulo ka lang dito. We should be able to thank them because they are another help for us. They may not be as knowledgeable as you as a critical care nurse, but what is important, we are a team and we will work together in order to address our concerns. And let us support staff resilience. I cannot end by not giving a few of my thoughts in terms of psychological support for patients. Because at the end of the day, the crux of the matter will always be in terms of how do we take care of our clients, our patients. If we are fearful, they're doubly fearful. We are anxious, they're seriously anxious. The calming presence of the nurses. They have their names there. Some nurses even pictures so that our patients will not be frightened by the PPEs. Who are these people coming in? I cannot even see their faces. I don't even know whether they are male or female before they speak. But what is important is you are there, giving them your presence, the calming presence. Maybe hold their hands anyway, you're wearing gloves. Listen to them from a distance. Provide them opportunity through social media to be visited by their relatives. That is very important. The most frightening experience ever now in this pandemic is being alone. Our presence tell our patients, you are not alone. We are here to help you. Easing uncertainty through correct information set. Sharing a lot of news. You know, our patients come in with their laptop and some patients come in with their iPads and cell phones. A lot of them will browse through a lot of information. But what is important and what's critical is to provide them with the correct information. Where do we get this? From our hospital, from WHO, from DOH, and CDC. Nothing else, because there are a lot of things being shared which are not really true. Reassurances. A smile. Maybe they will not see your smile, but the tone of your voice when you give them reassurances will make them calmer, will make them feel less anxious. So reassurances by the words that we tell them. It's okay to be frightened. Yes, we are helping you. We are here. You call us, we will be present all the time. Nurses, doctors are here available for you. We will do our best to be able to help you. And of course, as I mentioned, connection with the family through innovative ways. Therefore, as nurse leaders, what are the critical points that we have to consider for policy direction? I'm speaking now as a manager, speaking to the other administrators all over the country. There are a lot of experiences coming from this pandemic. Let us synthesize all their experiences to come up with evidence-based practice. Because COVID-19 is not the end. There will be more. SARS came, Ebola came. People say we prepared. But when COVID-19 came, nobody was prepared. So let us develop evidence-based practice. Let us share best practices. Probably it is imperative that we formulate guidelines and protocols to manage pandemics, not only COVID-19, but future pandemics. It's about time that we come up with a manual. China came up with a manual. It's written in Chinese, and they're saying they will share it. But you know, it may be different. Filipinos have different sentiments. Let us do it for our own country on how to manage pandemics. Let us design a human resource management system, again, to mitigate challenges of the global pandemic. In the new comprehensive nursing law, there was a mention about human resource management, not in terms of designing the staffing patterns in terms of ratio, but designing nursing pattern or plan in terms of patient acuity. This is the best way to do it. Know the needs of our clients. Know the needs, what is expected from us, so that we will have a really appropriate and sensitive kind of human resource management system. Third, harmonize principles on pandemic preparedness. In nursing education and training, we have disaster preparedness because we are a disaster-prone country, but we never, ever had that pandemic preparedness. Maybe at the minds of people at the Department of Health, but it has not been written. It's about time to do it. Nurses can pave the way for this. Let us conduct researches to gain better understanding of what are the new learnings we gathered from this experiences during the pandemic. It is why Angelique showed us a lot of surveys being done. We are preparing one for the Care Society or counseling group on how we have responded to the pandemic. This will actually prepare us for the next. This will provide us new learnings, and this will provide us mechanisms so that we can fine-tune our protocols. And lastly, collaborate with appropriate agencies to draft a pandemic preparedness and response plan. I called my sister, who is working in occupational safety and health, and asked her, do we have a pandemic preparedness and response plan? We have an occupational safety plan. She said, we have not gone through that as of yet, but we're starting to do it. We should have a pandemic preparedness and response plan in order to safeguard the health of our nurses, the healthcare workers, and everybody who's working in the hospital or even outside of the hospital. Because as I mentioned, this is the end, not the end of it. Let us be prepared in the future. I'd like to end my sharing by showing you how we manage the feelings of our nurses. At the end of their rotation as a team, they gather through social media, through Zoom, to talk about their feelings. And this is their way of maintaining connection and providing emotional support to each other. As you can see, a lot of them are home. Some of them are still in the hotels. But what is important? They were able to listen and share their experiences. Because at the end of the day, sharing and having the same feeling and realizing, wow, my feeling is universal. Everybody seems to have the same feeling. It's something that provides reassurance for all of us. Somebody who listens, somebody who can share the love, somebody who can share, yes, it's okay to be anxious and to be frightened. Because COVID-19 has provided us an opportunity to test the way that we think, to learn to adapt, to become a global health workforce. But our success will depend on our solidarity with teams and communities. And talking about solidarity, I just read a while ago about why Koreans now were able to manage the COVID-19, because they are cooperative, because of their solidarity, because of their communication, ability to communicate and share information, and because they trust one another. We should have unity as a community and as a nation and globally. There will still be uncertainties in this extraordinary time, and there will be things that we will have to face beyond this. But the aftermath of this will be a defining moments for all of us, because these are opportunities for all of us to play a prominent role in designing new ways of working as nurses, new ways of managing care of our clients, new ways of, taking care of ourselves. Because as they said, who will take care of the nurses but we ourselves? Keep safe and stay healthy. Salamat po.